In the first of our YouTube series, Dr. Shoemaker discussed the basic principles that underlie proper diagnosis of a chronic inflammatory response syndrome acquired following the exposure to the interior environment of water-damaged buildings. There are a number of tools that assist in diagnosis. Dr. Shoemaker will discuss these tools today.
Good morning. We talked about diagnosis of a CIRS, chronic inflammatory response syndrome, requiring confirmation of exposure to a water-damaged building using ERMI and HERTS-Me2. We also talked about presence of a unique grouping of symptoms found in patients who have this illness. This is not just one or two symptoms, this is many. Some people have found that having a symptom roster available will help go through symptoms present in an organized fashion. Along with this tool of a symptom roster, we're also looking at presence of the typical lab abnormalities seen in patients exposed and sickened by water-damaged buildings. These labs that we rely on are hosted in the resources section of the Surviving Mold website. Take a look at the labs, all the codes that are needed, the proper tubes and drawing techniques are reported there. The third element that makes diagnosis easy and readily available has to do with measurement of visual contrast sensitivity. This long-used test of functional vision will show a typical deficit found in patients exposed and sickened by water-damaged buildings, not found in folks without such illness. Presence of VCS deficits, and that's what we call it, VCS, together with symptoms and lab abnormalities, the potential for exposure, are all elements needed to get started on treatment.